How does Medicare Part D work? Let's take a look. So these plans are offered through private insurers, whether it's in the form of a standalone prescription drug Part D plan or embedded into a Medicare Advantage plan. Now, even though they're offered by individual insurers, they do have to follow the same structure. Now, one of the things when we talk about the structure is a lot of people look for plans that do not have a donut hole. Let me talk about the donut hole a little bit. This is the coverage gap, and really only 1 in 9 people fit that, fall into the coverage gap each year. And it used to be, when these plans first started coming out, a much, much larger problem. There was actually a real hole in the plans where if you reached a certain level, you had no coverage and you had to pay for the whole prescription drugs by yourself. Each year, that coverage gap got more and more narrow, and your cost share during that gap has decreased. And we'll get into what the cost of that is in the next slide. So like I said, each of these plans have a similar structure where there's 4 stages to it. First stage is your deductible period. Now, not all plans have deductibles. Some plans have deductibles on certain tier drugs, but all of them are going to have a deductible period, and whether the deductible is waived or not, that's specific to the plan. Once you reach your deductible, where you paid the whole cost of the drugs, you're now in your initial coverage stage. This is where you look up your formularies and the tiers, and you find out what your co-pays are for this next stage. Now, while you're in this stage, you're paying your co-pays. The whole time, your insurance company and Medicare is adding up not what you paid, but what the total cost of the drugs were. So you're in the stage until your total cost of the drugs reach $4,040. So you add what you paid plus what the insurance company paid to figure out how long you're in the stage. Once you're out of the stage, you are now in that donut hole, where, like I said, in the past, you had to pay the whole amount. It's been reduced over the past several years down to 25% is your share of the name brand and the generic drugs. And the other 75% is actually paid by the drug manufacturer. Important distinction is you get into the donut hole by what the total cost of drugs were. You get out of the donut hole by what your out-of-pocket costs were. Fortunately, they add what the drug manufacturer paid to the out-of-pocket costs. So in order to get in, it's $4,400 of your total drug costs. To get out, it's $6,350 of the out-of-pocket costs. And once you're out of this stage, you are now entered the catastrophic phase, where you pay little to nothing for your prescription drugs. It's capped at 5% of the cost of the drug. Now that we understand the general structure of a prescription drug plan, let's take a look at how to analyze each insurance company's offerings. First thing you need to do is make sure that the pharmacy that you want to go to is in the pharmacy network. Additionally, a lot of plans now are starting to offer preferred pharmacies where you can get extra discounts if you go to certain pharmacies. And you also will most likely have a mail-in order option where you get the preferred pharmacy reductions if you go that route. Next thing you want to take a look at is each company has a formulary for its specific plans. So a formulary is the list of the drugs, and just because something is tier 1 on one plan doesn't mean it's tier 1 on all the plans. It might be tier 2 on another company or not even covered on a third company. So each plan you have to take a look at that, and then each company's individual plans might have different formularies or different tiers. So you have to make sure you're careful about which plan you're analyzing. And now that you've taken a look at the formulary, once you find your drug, you might notice some different numbers or symbols next to the drug name. First thing is you'll see the T1, 2, 3, 4, 5. That'll tell you which tier the drug is on, and then you take a look back at the summary of benefits and you say, if it's a tier 2 drug, it's going to be this much cost. In addition to that, you might see the letters ST. ST stands for step therapy, and that simply means there may be a lower cost option that could save you and the insurance company some money on that prescription drug. Sometimes you might say, hey, I tried that drug a few years back and it didn't work for me, or it had a bad reaction with my other medications. So that's why a step therapy is. They're making a suggestion that you try the other drug. And if there's a specific reason why you need to continue to take that specific drug, that's something you would deal with your doctor, and you could ask for an exception. QL is quantity limits. There might be some drugs that may be too dangerous, perhaps, to give a large quantity at one time. So, they might limit you to a 14 or 30-day supply on certain prescriptions. The next set of letters you might notice are PA. That means you need prior authorization to continue to take that drug. There may be new prescriptions out there that have been proven to be more effective or specifically to treat your ailment. And the insurance company might want a more detailed explanation. So it's a more stringent form of step therapy. And again, you can ask your doctor to help you with this exception process. So what the insurance company is going to require is you go to your doctor and have them explain why they recommended this specific drug over the alternative. And if you do that in writing, the insurance company will typically get you an answer within 72 hours. Next, I would like to kick it over to Angela again for a brief discussion on how the Medicare Part D penalty works.
Hi, I'm Angela James at the Centers for Medicare and Medicaid Services. I've got some important information to share with you about Medicare and you. Medicare offers prescription drug coverage, known as Medicare Part D, for an additional charge to everyone with Medicare. If you don't use a lot of prescription drugs now, you may still want to think about joining a Medicare drug plan to help protect against higher costs in the future. And if you don't join a Medicare drug plan when you're first eligible for Medicare, and you don't have creditable prescription drug coverage, you may have to pay a late enrollment penalty if you join later. You don't have to pay a penalty if you have and keep creditable prescription drug coverage, or if you get extra help, which is a program from Medicare that helps people with limited income and resources pay for their prescriptions. Now, you're probably wondering what we mean by creditable prescription drug coverage. Simply put, creditable prescription drug coverage is drug coverage that's expected to pay on average at least as much as Medicare's standard prescription drug coverage. Examples of creditable prescription drug coverage are drug coverage from a current or former employer or union, or TRICARE, the Indian Health Service, or the Department of Veterans Affairs. Now, if you have creditable prescription drug coverage when you first become eligible for Medicare, generally you can keep it without paying the late enrollment penalty if you sign up for Part D later. The late enrollment penalty is added to your monthly Medicare Part D premium, and the amount depends on how long you went without creditable prescription drug coverage. Here's how it's calculated. We multiply 1% of something called the National Base Beneficiary Premium times the number of full uncovered months that you were eligible but didn't join a Medicare prescription drug plan and that you didn't have creditable prescription drug coverage. That final amount then is rounded to the nearest 10 cents and it's added to your monthly premium. You don't want to pay the penalty? There are 3 ways to avoid it. 1. Join a Medicare prescription drug plan when you're first eligible. 2. Make sure you don't go 63 days or more in a row without a Medicare drug plan or other creditable coverage. And 3. Tell your plan about any drug coverage you had if they ask you about it. If your plan thinks that you went for some time without creditable drug coverage, you may have to pay a penalty.
Thank you, Angela, for that wonderful explanation. Shopping for Medicare prescription drug plans is the most complicated, but it doesn't have to be the most difficult part of shopping for a Medicare plan. There's an amazing tool available to us on Medicare.gov's website. You plug in your zip code, your preferred pharmacies, your prescription drugs specific to the dosage and quantity, what type of plan you're shopping for, and they're going to help us do all that research. First time through this might take you an hour or 2. Our team's done this hundreds of times, so I would invite you to visit my website. Sign up for a half-hour consultation, provide us your list of your prescription drugs. We'll generate that report for you, help show you all the plans available to you in your area, show you specifically what they will cost at some different pharmacies, knowing the plans, which ones have preferred ones and whatnot, and help you enroll in the one that will help save you the most money that has all your drugs covered. Save yourself a couple hours. Get rid of the frustration, get rid of the unknowns, and come join us. We're happy to help.